for your introduction. Good morning, everyone. My name is Yoshiko Kondo from Hokkaido University in Japan. My professional background is in midwifery and reproductive science, and I also have a foundation in molecular biology, especially focusing on germ cell development. Today, I'd like to explore how we in health sciences can better navigate global health issues by integrating deeper understanding of life science technologies into our ethical and social decision-making. Since the Human Genome Project, genome science and life science technologies has advanced dramatically, profoundly influencing reproductive medicine. In Japan, non-invasive perinatal testing, or NIPT, and oocyte cryopreservation has recently spread rapidly in society. In Japan, Society and Obstetrics and Gynecology has recommended the integrated system for perinatal testing, including pre-test information provision, genetic counseling, counseling support, quality assurance of testing facilities, and post-test support for pregnant women. However, in practice, adequate genetic counseling is often not provided, even though prenatal testing can raise profound ethical concerns, including the possibility of pregnancy termination. Similarly, oocyte cryopreservation has expanded beyond medical indications. For example, Tokyo Prefecture launched a public subsidy program in 2023, yet the long-term impact for future pregnancy and safety remains unclear. These technologies bring great benefit but also raise complex ethical and social questions. In such a context, healthcare providers, especially those who face clients directly, play a key role in supporting informed decision-making. To do so responsibly, they need sufficient literacy in genetics and molecular biology. Yet previous studies show that while nursing students recognize the existence and basic nature of these tests, their understanding of the underlying technologies and how to interpret the result is limited. Specialist nurses involved in genetic care have also reported failing to inadequately due to insufficient knowledge and experiences, and patients expect clear, accurate explanation for support from both physicians and nurses. Against this backdrop, our study aims to clarify how students preparing for healthcare practice or life science research understand reproductive technologies such as NIPT, pre-implantation testing, and oocyte cryopreservation, and how this understanding reflects to their ethical views and potential role in supporting decision-making. While previous surveys have examined medical students or nurses' attitude towards prenatal diagnosis and selective abortion, there is little evidence on how knowledge of underlying life science technologies lead to ethical reasoning and support for client autonomy. By investigating this relationship, we hope to inform curriculum design and ultimately improve ethical, sound, evidence-informed reproductive care. So we conducted the study between July and November 2024. Participants were undergraduate students in their second to fourth year and master students from nursing, medicine, and life science programs. Recruitment was done by distributing flyers that include a brief overview of the study and the QR code linking to an online survey form. Those who completed the questionnaire were asked whether they would be willing to join a follow-up interview. Students who expressed interest were contacted by email and scheduled interviews. In the questionnaire, we measured the technical understanding of reproductive technologies and the ethical attitude toward their use. In the interview, we explored the participants' perceptions of these technologies and how they would support decision-making in clinical or research contexts. Okay, for the survey, we first developed 32 ad hoc questions to assess biological knowledge relevant to reproductive medicine and testing. Items covered four domains: basic biology, molecular biology, developmental biology, and clinical medicine. We deliberately included questions of varying difficulties. Some align with high school level basic biology, and some address advanced specialized principles underpinning and technologies such as prenatal and pre-implantation genetic testing. Several researchers reviewed the draft to ensure content validity and triangulate item quality. Students rate their own understanding on 5-point scale from never heard of it to able to explain in detail. And to explore attitude toward the social applications of reproductive technologies, we created 35 items informed by previous studies of students and nurses' view on prenatal and pre-implantation testing. Items were divided into two perspectives: a general societal viewpoint and personal viewpoint, allowing us to capture the difference between thinking about the society at large and one's own possible reproductive choices. Responses were given on 5-point Likert scale from strongly disagree to strongly agree, with higher score indicating greater acceptance of technology use. For the qualitative component, we conducted semi-structured interviews guiding a predefined interview protocol. Interviews were audio recorded through transcribed and analyzed using qualitative content analysis together with narrative responses from the open-ended survey questions. So we received 188 survey responses. One response lacked the information about the participant's major and excluded, leaving 187 valued respondents for analysis. Of these, 59 were nursing students, 74 were medical students, and 55 were life science students. At the end of the questionnaire, we asked the respondents would be willing to participate with the interview. 39 student volunteers, and we contacted all of them. Ultimately, 13 completed the interviews, 4 from nursing, 4 from medicine, and 5 from life sciences. Here's the survey result. As expected, biology students show the highest level of understanding, while nursing students scored the lowest. The differences in the understandings were statistically significant across all the groups. Next, regarding attitude towards scientific technological applications, nursing students scored significantly lower than the other two groups. This indicates that compared to medical and biology students, nursing students were less likely to hold an uncritical belief that scientific technologies should be actively used. In addition, as shown in this scatter plot, higher level of understanding of science and technology were associated with more favorable attitude toward their societal applications. Although the association was weak, it was consistently positive, with the correlation coefficient of R equals 0.18 and the statistically significant p-value of 0.017. Now we are moving on the quality findings. Through content analysis, we extracted 8 categories and 35 subcategories from students' narratives. Overall, students across all fields generally held a positive view towards their use of scientific medical technologies. And let me show a few distinct narratives from each group. Among medical students, a narrative often emphasized the benefit of scientific and technological achievement, such as the value of freezing sperm or oocyte for future medical use, or taking proactive measures against clearly defined diseases. In contrast, nursing students more frequently expressed hesitant emotion toward human manipulation of life and ethical dilemmas arising from each technological process. For example, while some students acknowledge the advantages of reproductive technologies, others stated, if such tests did not exist, people would not have to face the decision of abortion. Or I would not choose abortion myself, but I cannot deny others' choices. This narrative illustrates coexistence of hope grounded in medical benefits and moral ambivalence towards social implication of life science technologies. Okay, among biology students, in addition to negative feeling towards human manipulation of life, strong concern were expressed about the societal application of such technologies. Their narrative often reflected the biological perspective on potential risks. For example, some noted that cells may deteriorate during breathing and growing stages. If possible, it is better to conceive and give birth without relying on such method. Others voiced worry that permitting genetic modification could reduce the genetic diversity, or that expand the application of these technologies might inevitably invite accumulation of eugenic thinking. Across all disciplines, many students reflect on their own lack of adequate knowledge and emphasize the need to accumulate accurate understanding. They also express concern about the overwhelming amount of misleading information on social media, noting that it is difficult for the public to extract only reliable sources. Several students stress the importance of fundamental education and development of an educational tool that communicate both the benefit and the risk of reproductive technologies. Okay, let's wrap up my talk by summarizing key findings and their implications. First, in terms of the understanding, biology students can show the highest level of knowledge while nursing students scored the lowest. These differences was statistically significant across all groups. We also find a weak but significant positive association between understanding and acceptance of reproductive technologies. Second, the qualitative findings reveal the important differences in ethical perspectives. While most students recognize the benefit of technology, nursing students in particular expressed greater hesitation and moral dilemmas. These findings suggest that scientific knowledge alone is not enough. Ethical literacy and critical thinking must also be nurtured, especially for future healthcare professionals who will support a patient decision making. To conclude, I would like to leave you one key message. Reproductive technologies are fundamentally different from other medical innovations because they engage directly with the creation of life. This means that scientific progress alone cannot guide us. It must be balanced with the ethical responsibility. Therefore, future healthcare professionals need more than technical understandings. They must be able to think critically, to communicate with sensitivity, and support truly informed choices. In the end, enhancing literacy, not only scientific but ethical literacy, is essential to bridge technology and responsible care. Okay, thank you very much for listening. And this study was mainly conducted by Ms. Nozomi Honma, who was the previous member of my lab, and she's now working as a nurse in Hokkaido University Hospital. And I also appreciate for the support for the grant in aid scientific research. I look forward to your thoughts and questions. Thank you very much.